So the investigations, first hematological investigation ആണ്. Hematological investigationൽ first you should rule out the anemia, that by looking for the hemoglobin level, the complete blood count, then PCV, then the peripheral smear, okay, then the serum ferritin level. These are looking for ruling out the anemia and its severity. Then you should look for the coagulative disorders. That should mainly you should look for the platelet count. So by platelet count, if there is any abnormality in the platelet count, it is indicating ITP. Okay, it is indicating ITP. Then you should look for the clotting time, bleeding time, and also the APTT. Okay, clotting time, bleeding time, APTT you should look for. So I said now platelets. If there is platelets abnormalities, it may be ruling out ITP, means in idiopathic thrombocytopenic purpura. Okay, then bleeding time, clotting time, APTT. Okay, so mainly this coagulation profile is done for if the patient is having any clinical, while doing clinical examination, any signs of bleeding diathesis like petechiae bruosis, okay, or if the person is on anticoagulant therapy, mainly the coagulation profile is done. Then you should look for the thyroid function test. Okay, thyroid function test. So anemia, then thyroid function test, then coagulation I said. Okay, so that's it. Then after that you should look for the ultrasonography. In ultrasonography you can find out the structural causes, mainly transvaginal ultrasound, and after also you can find out the uterine size. If there is an increase in uterine size, your DD should be fibroids and adenomyosis. Then endometrial thickness, if in case of a menstruating woman, if it is greater than 12 millimeter, or in postmenopausal woman, if it is greater than 4 millimeter, it is abnormal only. Then after, if while doing the ultrasonography, if there is any pathologies you are finding, then you should do the hysteroscopy in that selected cases. Okay, but hysteroscopy is done in some cases, and while mainly in case of polyps we are doing the hysteroscopy. So if anyone asks what are the indications of hysteroscopy, then if there is an intracavity lesions found out on ultrasonography, and in case the patient complains of intermenstrual bleeding and we found out that is polyp, then also you should do hysteroscopy. And history of curettage or AUB, okay, in these cases you should do for hysteroscopy. And this hysteroscopy is both diagnostic and a therapeutic sadhanamana, and the hysteroscopy എന്ന് പറയുന്നത്. And you should also, if there is an endometrial pathology, the main investigation choice for endometrial pathology is endometrial sampling or endometrial biopsy or aspiration cytologies. Okay, it is an OPD procedure only, and mainly for endometrial sampling the instruments are what Pippelle, okay, Pippelle or Vabra aspirator. And in India it is Karman's cannula is used. Okay, Karman's cannula is used. So these are the things you should look. Okay, and I also said that like adnexal masses, like ovarian mass, tubo-ovarian mass. Okay, this also can find out on USG. Okay, adnexal masses, and if there is fluid in the pouch of Douglas, and in case of fibroid, you should look for the pressure effects on ureter and the kidney. Okay, so I said now endometrial pathologies, what are you doing? You can do the endometrial sampling, then aspiration, endometrial aspiration, D and C, dilatation and curettage. And if the lady is greater than 40 years, fractional curettage can be done. And the last is hysteroscopy and directed biopsy also done. So these are the investigations you should remember. So this is the investigation algorithm for a reproductive age group. In reproductive age group, if I do the urine pregnancy test, and if it is negative, you should look for the ultrasound, where TVS is more done in greater than TAS. And in TVS, if the endometrial thickness is greater than 12 millimeter, or the normal, or we get a normal ultrasound, but there is persistent bleeding. And the third case is high risk factors are there, like PCOS or the granulosa cell tumor, or the person is very obese. Okay, so in these conditions you should look for endometrial biopsy. Okay, so you should look for TVS and also endometrial biopsy. And in case of TVS, if the endometrial thickness is greater than 12 millimeter, or if you get a normal USG plus persistent bleeding, also you should look for endometrial biopsy. And if there is high risk factors, then also you should look for the endometrial biopsy. Next, in case of perimenopause woman, perimenopause means in India it is the women who are greater than 40 years, and worldwide that is greater than 45 years. Okay, menopause means 47 years. In India it is 47 years, and worldwide 51 years. Okay, so that is the perimenopause. So in case of perimenopausal woman, First, irrespective of the ultrasonography, you should look for UPT here also. Then after that, you should look for by endometrial biopsy also. Endometrial biopsy. Next, in case of postmenopausal woman, in postmenopausal woman, first you should look ultrasonography, that is transvaginal sonography, then endometrial thickness. If the endometrial thickness is less than 4 millimeter only, then you should give tranexamic acid. Okay, you should give tranexamic acid, and still the bleeding is persisting, then do fractional curettage plus hysteroscopy. And okay, so the fractional curettage and hysteroscopy, that is a gold standard for finding the endometrial pathology, and this is done under general anesthesia and in OT. And if the endometrial thickness is greater than or equal to 4 millimeter, then you should do endometrial biopsy. Okay, don't give the tranexamic that treatment. Here, if it is greater than 4 millimeter, 4 or greater than 4 millimeter, then endometrial biopsy.